Hello, this is Dr. Bob and Debbie DeMaria once again with another half hour of health program. And tonight we're going to talk about one of the most common, popular topics that we ever discuss, get the most emails on, the most questions about, and that happens to be weight loss and detoxification. They work with each other. It has been estimated that up to 60% of our adult and overall population is or are obese. And there are so many people today that are clinically obese, morbidly obese, so much so that one of the most popular programs on TV happens to do with weight loss. And this is very serious because most overweight people become diabetics. Most diabetics are overweight. It has been estimated that 1/3 of all the children born in the first decade of the new millennium will be a diabetic by the time they're 30 years old. And it is frightening. And we see patients that come into our office all the time that not only can have joint pain because their body has been carrying the extra weight around, but we see so many people that have issues with emotions, depression, anxiety, heart palpitations, skin problems because of obesity and being overweight. And then it appears that people always, because of media today, because of the internet, people always want to take something. They always want to do something to lose weight. So we have a book. It's called Dr. Bob's Drugless Guide to Detoxification. It's a very simple book. There's a toxicity question in there. I would encourage you to obtain the book. You can go to our website, go to Amazon.com, Dr. Bob's Drugless Guide to Detoxification. Take the assessment. So many times you could even have chronic joint pain that's caused because of liver congestion. I don't believe, Debbie, that most people realize that the function of their body affects joints, tissues, and skin. And before I turn this over to Deb, because I know she's waited with bated breath to say something, coated tongue. A part of my training, I have a Doctor of Natural Health degree. I've taken classes on Ayurvedic or Asian Indian medicine. And if you have a coated tongue, it's called AMMA, A-M-M-A. It's a body signal to me that your body is toxic. So some of you might be brushing your tongue in the morning because it's thick and pasty. It will not go away until you make wise, necessary changes.
Well, you know what, Dr. Bob? It's really interesting to me that when we think about weight loss and detox, I also think about bowel movements. Now, you're probably going to say, Debbie, now where in the world do you come up with that? Well, you know, one of the things, because of the low thyroids that we have in the whole world, not just the United States, we have lesser bowel function. And the reason is because you have a low thyroid. And so what ends up happening is there is an increase of weight. So what we have to do, I believe too, for the detoxification and the weight loss process is to also work on bowel function. You probably didn't think I was going to throw something like that at you, did you, Dr. Bob?
Well, here's the scoop, and I talk about this a lot when I speak out in public. And by the way, wherever you're at, anywhere in the world, Debbie and I travel worldwide and we speak for businesses, organizations about health and wellness. And we have found that today the business world is so competitive. If you have a sharp, healthy crew, you're going to be more successful as a business person. But I'm kind of snickering right now. Oftentimes will say to someone, okay, how many of you have at least had one bowel movement today? Or I'll say you should have everybody should have had at least two, and maybe some of you had three. And the people who have had no bowel movement at all will always put their head down. And the people who have done two or three will always do this. They'll always let you know the number of bowel movements they've had. And you say, Dr. Bob, that is pretty disgusting. No, we talk about bowel movements all the time in the practice. It's so critical because if you're not having a bowel movement, you have a process called auto-intoxication. In other words, transit time. That's the time you eat something from this part of your body and it goes out and it's relieved by the other end. When somebody comes in and they're not having a regular bowel movement, that means every day, 2 to 3 and up to 5, firm stools, not loose stools with mucus in it, a firm stool. Debbie, it comes down to, and I have done seminars on this, impaired thyroid function. This is a shower dechlorinator. We've talked about this so many times on the program. Standing in a 4x5 gas chamber in the morning during the daytime, you're breathing in chlorine gas, and that gas is antagonizing to thyroid function. So if your thyroid gland is not functioning optimally, you're not having a proper bowel movement. So one of the books that we've been blessed to write is Dr. Bob's Guide to Optimal Health. And in that, we encourage our patients, I'm encouraging you, our viewing audience, our clients, our worldwide guests, to start your day off with a wedge of lemon. Get the lemon, cut it into a wedge, squeeze the lemon into pure water. Warm water would be good, not necessarily hot water, but warm water. Sip on the water, eat the lemon when you're done. That helps promote liver function. Your liver, which is my visual for the liver, which is the oil filter of your body, is critical for you to lose weight. I have learned a long time ago that if your liver is not functioning optimally, you will not lose weight. How do you know if your liver is functioning optimally or not? A couple questions to ask you. Do you have varicose veins or spider veins? Do you have hemorrhoids? Do you have little red bumps on your body called cherry hemangiomas? If you have those body signals, that's a body signal to me that you have an issue with a compromised liver. What do you eat? Dr. Bob's ABCs. A half a red apple every day, third cup of beets, preferred organic graded raw. We also bake beets. If you don't know how to bake beets, go to YouTube, type in my name, Dr. Bob DeMaria, put in baking beets, and you'll see me there. It's amazing. Thousands of people have watched Dr. Bob make beets. Beets are important. We eat up to 10 beets every day. We put it on our salad. Here's something else that will help improve bowel function. Water. You should have a measured container of water, and you want to drink a minimum of a quart of water every day. Plus, you want to eat your 5 servings of fruits and vegetables. I make sure I eat celery and radishes every day. Why? Radishes, now listen to this, are a bitter herb. Radishes promote liver function. Celery is fiber. Radishes are fiber. Fiber is not the seeds that are in the raspberries that are in your raspberry donut. That's a joke, by the way. When you eat food that doesn't have fiber in it, your intestines doesn't have anything to grab onto. Peristalsis, which is transit time. Now, some of you may have a magnesium deficiency. Magnesium helps promote colon movement. We have a product on our website called MG, Mary Go, MG-zyme. You could take up to 4 before you go to bed at night. What would even be more appropriate for you was to start to eat a salad. Debbie and I have a salad every day. Greens are a source of chlorophyll. Chlorophyll is a source of magnesium. Magnesium is important for proper bowel function. Pretty wild, isn't it, Deb?
Dr. Bob, you know, proper bowel function is very, very important. And I know that it is because in our bowels, we are taking away toxins. And that's the part of the detoxification process. That's why weight loss and detox are so intermingled. Recently, we've been doing some testing in our office, and that there is 2 new words that I have seen. And I thought it might be a good idea if you explain what leptin and ghrelin are, Dr. Bob, because those fascinated me, and I really believe it could be the key to some of these people's weight loss situation.
Well, you know, Deb, it's amazing how many new terms that there are out there. It's like every day you read about something, and maybe some of you have never even heard of the word leptin, L-E-P-T-I-N. Leptin tells your body, your brain, you're full. So I know I have so many people come to the office and say, Dr. Bob, I'm always hungry. Leptin, L-E-P-T-I-N, tells your brain you're full. Now I'm going to share a little nugget with you. High fructose corn syrup, HFCS. You know, what's so intriguing is that food manufacturers try to figure out new terms and ways to prevent information. So they know that most people are aware that high fructose corn syrup is not accepted as healthy, so they call it HFCS. High fructose corn syrup impairs leptin in your body. So if you have a child right now and you're going to a fast food restaurant, oftentimes they'll use high fructose corn syrup in some of the ingredients so they can finish eating a meal and be hungry. Some of you, and I want you to look at the applesauce that you're eating, because applesauce itself is awesome. God created apples. Apples are good. God made apples, but when man starts tampering with an apple and makes applesauce and puts a lot of chemicals in it, they use high fructose corn syrup to sweeten it. So a child could finish eating an awesome meal, have some applesauce, and be hungry immediately afterwards. The other compound that Debbie talked about, it's the other hormone would be more appropriate, is called ghrelin. Ghrelin tells your body you're hungry. So I was researching how do you minimize ghrelin in the body. And the best way to minimize ghrelin in the body is to eat more protein and eat more, listen, I'm going to word this to you, more logical mid-glycemic meals. Ooh, that's a big word. Mid-glycemic is the way that a food impacts blood sugar in your body. I'll give you an example. A rice cake, which you would think is healthy, and I'm not saying it's not, by the way, let's say it has a glycemic level of 95. So we go from 0 to 100, 100 being the highest. A rice cake being 95 means that it's going to throw your blood sugar way up. But if you put some almond butter on it, it slows down the insulin release. So what we have calculated is to keep your ghrelin under control, that means subsided, you want to eat more minimal small meals through the day. I encourage our patients to eat a swap bag. Start with the protein, celery, red, yellow, orange bell peppers, carrots, some tomatoes, cucumbers. Put them in a container and through the day eat those vegetables. Then throw in some almonds, cashews, walnuts, shredded unsweetened coconut. That helps keep your blood sugar stable, so all day long you're not going high and low and your emotions are stable, so you're not constantly hungry, but your blood sugar stays the same and your emotions are the same. We're going to take a short break. We'll be right back to talk about what you can do to lose weight and clean that body from the inside out. Hello, this is Dr. Bob and Debbie DeMaria once again with a half hour of health program. The first segment, we are talking about weight loss and detox. I want to share with you some cutting edge research assessments that we've been doing in our practice. And wherever you're watching us, anywhere in the world right now, we can send you this tool that you could literally use yourself. So we can do an assessment with computer software that we're developing. It's a galvanic skin response. See, we can measure brain function, EEG, heart electrical function, EKG, nerve function, EMG. Well, because of science, today, we could literally ask your body electronic questions signatures. Basically what you do is you put your hand on a cradle. The cradle is plugged in to our computer, which we have, with a technical team, developed a program, a software program that can ask your body stressors. I developed this program, which is weight loss and detox, because I was praying about, Lord, there are so many people today that can't lose weight. Why is that? I have 25 reasons that people may have a weight challenge. Number one, they're toxic, hence weight loss and toxicity. See, if you're toxic, whatever that means, your body will hold on to fluid and weight because your body uses fat as the toxic dumping syndrome. Not to be silly, but if you have cellulite on your buttocks or on your thighs, those are layers of toxins that your body has put away. It's like a toxic dump with skull and crossbones on it. So let's say that you're a truck driver, a bus driver, you spend a lot of time on the road. I have personally witnessed and seen through the galvanic skin response cadmium toxicity, lead, mercury, and arsenic. So we live in a very toxic society today. The air we breathe, the water we drink, the food we're putting in our body. You know, recently one of the health experts in America was grilled because of him mentioning arsenic in apple juice. We are bombarded with chemicals every day. You may have amalgams in your mouth. Amalgams is the silver. It has mercury, which paralyzes digestion. So that's just one aspect. So if you are exposed to toxins, you may have a weight loss issue. Nobody ever may have mentioned that to you before. That's also one of the reasons that we also do mineral tissue hair analysis. Through the galvanic skin response, we're also seeing a lot of people have brain exhaustion. Their brains are tired. We can also assess that through blood testing. We check a person's TSH, Tom, Sam, Harry. If it's less than 2, oftentimes we know that the pituitary gland is not functioning optimally. Wouldn't it be awesome to do a non-invasive test that you could put your hand on the cradle, and within 5 to 7 minutes we can evaluate and assess the electronic signatures in your body? We've had people that have had adrenal glands. Now, the adrenal glands are a pair of glands located on top of your kidneys. And if you're underneath a lot of stress and you're going a million miles an hour, your cortisol level could be elevated. If your cortisol is elevated, I'm going to throw a new term out to you right now. It could be cannibalizing your muscle. Once you break 40 years old, and trust me, we see so many obese children between 4 and 20 years old, but once you break 40 years old, your body loses muscle tone. We actually have seen people, watch this, listen to this, have elevated phosphorus on the galvanic skin response. The phosphorus comes from muscle cannibalized in the body. We can also see it on a mineral tissue hair analysis. So the adrenal glands could be exhausted. We've seen muscle tissue show up, so you need to eat more protein through the day. We may need to do an assessment to your adrenal glands. We also know that so many of you watching us right now are saturated with estrogen. We live in a sea of estrogen. If you have a larger tummy, a bigger abdomen, estrogen prevents weight loss. Estrogen prevents weight loss because it sabotages thyroid function. Do you have tender breast and heavy menstrual flow on a consistent basis? You may have too much estrogen in your body. Do you have little red bumps on your body? They're called cherry hemangiomas. It's too much estrogen. So you may have a weight loss issue because of that. We can literally, because we talked about this before, check your leptin and ghrelin levels with the galvanic skin response. We also have seen individuals have challenges with colon function. if you're not having a regular bowel movement. Something that's also quite interesting, and we see this with blood tests and different forms of microscopy, elevated yeast. Do you crave bread, pastas, and pizza? You may have a yeast challenge in your body. So we can test you literally anywhere in the world. You can go to druglessdoctor.com, send us an email. We'd just be privileged for you to be a part of having this assessment done. This is cutting edge research information that we've been using in our office for over a year now, and we're making available to our worldwide viewers and clients.
Dr. Bob, what's really amazing to me is, we can also test, and it shows up on the testing, is about partly hydrogenated oils and how that alone can sabotage you from losing weight. Also, Dr. Bob, organic. Eat organic. It is said that if you eat organic, you could actually lose 7 pounds per year without changing anything. It's the toxins that are in our foods that are being sprayed or injected actually to make their growth greater that we're eating, and then we hold the toxins in our body, which keeps weight on us. So these are all things that we can test for and that you should know. So read labels too, because just as Dr. Bob mentioned about the high fructose corn syrup, you need to read the labels, because sometimes you think it's natural, but natural doesn't always mean the best.
And so Debbie made some really good points in reference to organic food. And I've had patients lose 20 to 25 pounds just switching from conventional food to organic. A thought. When you look at items at the grocery store and they have the barcode, and under the barcode there are numbers. Number 9 means the product is organic. Number 8, it's genetically engineered. All other numbers are considered standard. In other words, they're conventional. They're not genetically engineered. They're not organic. They're food that probably has some kind of spray on them. You would choose, because remember we talked about the cellulite and the toxins. The average woman puts 150 chemicals on her body every day. Here's another thought process that you may not have contemplated before. It's sleep. You should wake up hungry. If you wake up and you're not hungry, your body is not making growth hormone. And that's one of the questions that is on the galvanic skin response, is growth hormone. And any time that we assess somebody and their growth hormone is not there, we know that they're not sleeping through the night for various reasons. But we use a product called Gaminol Forte, which helps build lean muscle tissue. Some of you may have challenges falling asleep at night. That alone can help you lose weight. We talk about this liver so many times. Part of the scan that we do, the galvanic skin response, is that we assess liver. The liver is a part of that. And if your liver is not functioning optimally like I told you, you're going to have a greater chance not to lose weight. And let's say you have gallbladder, a history of gallbladder surgery. Do you have bitter metal taste in your mouth? Does your right knee hurt? Do you have right shoulder blade pain? Those are all body signals of congested liver function, stasis, or improper flow of bile. Your body needs bile for proper fat metabolism. So we may have to help improve your liver gallbladder function. So in Dr. Bob's Drugless Guide to Detoxification, I mentioned to you at the beginning of the program, there's a toxicity questionnaire. It'd be wise of you just to get the book to take the questionnaire. And then we talk about specific food that you should eat, preferably whole foods, organic foods, eliminate processed foods. Probably the biggest food that you need to stay away from is high fructose corn syrup. But what we've learned through research, and I've done so much research on weight loss itself, is avoid beverages that have lots of calories in them. When you go to your favorite coffee cafe and you have them put pumps of whatever kind of flavoring in it, those pumps have sugar in them. Be aware when you go to the franchise restaurant, any liquid, in a 12-ounce can of soda, we're talking 160 calories. And as a side note, if you're consuming diet soda, over time, diet soda can compromise liver function. Make sure you're drinking water from a pure source. By drinking water from a pure source, you're also helping your body eliminate toxins through your skin, through your breath. These are all little tips that'll make a difference. A couple thoughts: you can have an essential fatty acid blood spot test done to you. That'll tell me if you have trans fat high in your body. People who consume trans fat always have a problem losing weight. You may want to go to our website, send us a note, request the galvanic skin response. We can send a cradle anywhere in the world to you. It'll make a huge difference. If you live locally in the Northern Ohio area, why don't you come in as a new patient? We see people all over Northern Ohio, and they're always so happy to see us because we will do an assessment to the body, give you a report of the findings. Make that call today. You'll be glad you did.